Hi, I'm Dr. Annette Zaharoff. I'm the Medical Director for the Non-Surgical Center of Texas. And I'd like to talk to you today about shoulder pain. Shoulder pain is a very, very common problem. A lot of overhead athletes who do throwing, pitching, oftentimes have injuries to what's called the rotator cuff tendon. If you're not an athlete, though, you might even get injuries from doing a lot of overhead activity or a lot of lifting. Things where you might be reaching overhead cause some strain to that group of muscles. What ends up happening is that we develop pain on this outer part of the shoulder. And when you reach for things, or you try to lift or go overhead, or even a simple activity like laying on that side at night can wake you up because of pain. So there are ways definitely to prevent that. One is if you build those muscles up before you get injured, it's less likely that you're going to have an injury for that group of muscles called the rotator cuff tendon. But if the injury does develop, you want to go through some of your first aid treatments. That can include simple, basic first aid treatments like ice. Other things are like modifying activities. So you try to avoid doing things overhead with any heavier loads. If the pain persists, you can do some over-the-counter medications like anti-inflammatories, but you don't want to stay on those too long because they can cause some side effects. Then, if that pain is really lasting over a week, it's good to seek medical attention. Have your doctor evaluate it, determine how severe the injury is, and hopefully prescribe therapies. Potentially physical therapy would be very useful for this type of problem. Typically, an acute injury to the rotator cuff tendon should heal within 2 to 4 weeks. If it's a chronic or repetitive injury, however, it may not heal, and it may need some other therapies. When you see your doctor, they may recommend an x-ray initially. An x-ray will take a look at the bone and joint areas to see if there's any damage to those regions. If you go through therapy and the pain persists, your doctor may also recommend an MRI test. And that test is to actually take a look at the tendon and look at where it attaches and see if there's any tear along that region. In which case, the prognosis or how you're going to recover may take a little bit longer and may need some other types of therapies. So there are different types of treatments that may be used to treat a shoulder pain to the rotator cuff tendon. Initially, good physical therapy may be enough, where the therapist will do treatments with deep heat ultrasound, electrical stimulation, and may do some things with taping to help support that tendon a little bit more. If the tendon's healing, then they'll begin exercises to regain strength and motion. If the therapy alone isn't enough, your doctor may recommend different oral medications, some medications for inflammation if needed, or if it's a severe pain problem, they even may recommend cortisone injections. But again, cortisone is only a temporary pain reliever. If long-term the shoulder is not healing, you may want to consider regenerative injections, such as platelet-rich plasma injections. These are all things you can certainly talk to your physician about.